we have, through some very good early decisions that were actually ridiculed at the beginning, we closed up our borders to flights coming in from certain areas, areas that were hit by the coronavirus and hit pretty hard. And we did it very early. A lot of people thought we shouldn't have done it that early, and we did, and it turned out to be a very good thing. And the number one priority from our standpoint is the health and safety of the American people, and that's the way I viewed it when I made that decision. Because of all we've done, the risk to the American people remains very low. We have the greatest experts in the world, really in the world, right here. The people that are called upon by other countries when things like this happen. We're ready to adapt, and we're ready to do whatever we have to as the disease spreads, if it spreads. As most of you know, the level that we've had in our country is very low, and those people are getting better, or we think that in almost all cases, the better are getting. We have a total of 15. We took in some from Japan. You heard about that, because they're American citizens and they're in quarantine. And they're getting better too. But we felt we had an obligation to do that. It could have been as many as 42. And we found that it was just an obligation we felt that we had. We could have left them, and that would have been very bad, I think, American people. And they're recovering. Of the 15 people, the original 15, as I call them, 8 of them have returned to their homes, to stay in their homes until fully recovered. 1 is in the hospital, and 5 have fully recovered. And 1 is, we think, in pretty good shape. And it's in between hospital and going home. So we have a total of, 15 people, and they're in a process of recovering, with some already having fully recovered.